Let's talk about certain laser treatments for highly melanated skin. Now, lasers can be very tricky for darker skin, and so this video should not be taken lightly. Please note that I am a nurse. I've been working with lasers and all Fitzpatricks for a very long time, so this is something that I consider myself an expert in. Consider this your guide to unlocking laser safety, especially as a woman or man of color. I want to dive deep into it for you. Now let's talk about why there is a risk with treating higher Fitzpatricks or darker skin tone with lasers. There is a huge risk because there is something called PIH, which is post-inflammatory hyperpigmentation, which comes from heat. It comes from inflammatory responses, and so lasers can create that. So I want to kind of say why it's risky before I dive into what laser is appropriate. Now, all patients, whether you are thinking about getting laser or you are actually getting laser done, you want to make sure that you learn what laser they will be using on you. You do a deep dive on that facility, and you do a deep dive on the person who will be performing the procedure. It's very important to know their credentials. It's very important to know, basically what machine they're using, because that's all very much important. I want to simply say that not all lasers are made the same. Some are IPL based, and then there are YAG lasers. The most safest, I want to start off by saying not all lasers are made the same. There is IPL laser, then there's also YAG laser. YAG laser can be used on darker skin tones. It is safe enough to use on darker skin tones, but the reason why it's important to know what your technician is doing, because the wavelength is what matters. The joules is what matters. That's your actual treatment. And so you do want to talk with the nurse or doctor that's doing the laser on you so that you can kind of get a full understanding as to what's being performed. Now, as I said, some lasers are safe for darker skin tones, and that would be considered something like a YAG laser. What that laser does specifically is it kind of bypasses superficially on the skin so that it doesn't heat that skin up, causing scarring. So really that's the functionality of it. That's why it kind of is very good for us, because it doesn't allow for that burning, because the mechanism of the machine is a little bit different. Now again, ND YAG lasers are best for darker skin tones because it does not affect the surface layer of the skin. Therefore, you can do laser hair removal. You can certainly do tightening of the skin. You can do lifting of dark spots. You can do all of those things and not create damage to the skin, which is very important for darker skin tones, because the skin can create, like I said, PIH or post-inflammatory hyperpigmentation, and that is very hard to resolve once you have it. It's something that will take a lot of work to get rid of those kind of scars. I have worked on that type of scar. It is not something that happens overnight. It's months and months to years of correcting the skin. Now, if you are a practitioner or if you're a patient looking to have laser hair removal done, looking to have like a laser genesis done, it is important to know that low and slow is the key. When you are working with your practitioner, or if you are a practitioner, you want to make sure that if it usually takes you about 6 treatments to complete, let's say a Fitzpatrick 2 or 3, it might take you a little longer to treat a Fitzpatrick 5 or 6, because you don't want to increase the joules and things like that too high. You don't want to risk PIH, so you want to go low and slow. That's the name of the game, low and slow. It's better to have a lower dose and a longer length of time and know that you're not going to burn anybody than trying to rush through your treatments. Now, there are a few tricks that I have found. Someone using hydroquinone has really been a great find and help for me, because it helps rebound any hyperpigmentation that would ever come about. And so to have someone on a hydroquinone is really good. I've only seen amazing results following it. Hydroquinone is a great skin lightener, especially for someone who has deep hyperpigmentation, especially for my PCOS clients who have had that reoccurring cystic acne and things like that, definitely hydroquinone has been a lifesaver for them, and in turn has really made the results that I provide amazing, and it has really helped speed along a lot of things. As somebody who's been using Nd:YAG, I always definitely do stress the fact that these results will not happen overnight, because we are playing the lowest low game. A lot of patients, they are perfectly happy, they're super content, and the hair or the dark spot does lift up pretty quickly, but it's always good to just be safe. I never want to overpromise somebody something. I'll rather let them know what it is, and if they get a better result, then that's fine. But I don't want to give them a promise of 6 treatments or so when it may be more. When it comes to treating skin of color, the most important thing is sun protection. Whether you are doing any laser, Nd:YAG, Fraxel, if you're doing microneedling, anything that you may be doing, you have to stress the importance of sun protection. As a practitioner, I do stress that fact. In fact, I won't treat someone unless I know that they purchased the sunscreen with me, because the last thing you want to do is do these kind of treatments on somebody and then they're not protecting themselves and they go outside and they burn or whatever it may be, because it will always come back to you as a practitioner. It will always come back to your office. If you're a patient watching this, I would say, please, if someone is stressing the importance of sunscreen, you want to get the best bang for your buck, please do everything you can to use sunscreen. I know it sounds very mediocre and like it's just BS, but it really isn't. The sun is shining every single day, and it is affecting your skin every single day. So you definitely want to protect your skin. Again, I just want to stress the fact that yes, if you are a darker skin tone, you absolutely can get laser. Do not be afraid to get laser. Laser is amazing for our skin. It just has to be the right laser. It has to be the right settings, and you can really get the amazing benefits from them.